Geratophobia is the illogical, unreasonable fear of old people and of getting old. And we have an epidemic of it.
Maggie Kuhn, co-founder of the Grey Panthers and one of the great leaders and spokespersons of our time, is making a unique contribution to American society. She is challenging age-related prejudice and generating national support for the needs inherent in the aging process, from the United States Senate to the American Medical Association. With her extraordinary energy and insight, Maggie Kuhn portrays the admirable spirit, commitment, and new image of aging in America.
Our focus is not on old folks' issues. We're not a gray lobby. We're not working for the special interests of old people. We're working for the special interests of people, humanizing, hopefully, and healing our society of its divisions.
Okay. Thank you. Thanks, Emily. Hello, everybody. Good afternoon, everyone. Glad to have you joining us. Welcome to our Transformation Tuesday series, which we've been hosting on the final Tuesday of the month since 2021. It's wonderful to have you all here and hope you're hydrating during this awful heat wave. I'm Michelle Arnaud, leading the New York chapter, and on behalf of our board, please accept our sincere thanks for your support for the Grey Panthers movement, which was founded in Philadelphia in 1970 by our fearless leader, Maggie Kuhn, whom we just saw in that clip. Our mission, as stated by Maggie over 50 years ago, is to combat ageism and age discrimination while promoting intergenerational contact, which is the intention of our series. Today, we're going to revisit the topic that sparked this series, namely the impact upon and mistreatment of older adults during the COVID pandemic. We have an award-winning author, Dr. Margaret Morganroth Gullette, who will present her latest book entitled American Eldercide: How It Happened, How to Prevent It. It was 4 years ago in May of 2021 that we Grey Panthers aired our documentary, Honoring Nursing Home Lives Lost, to honor those who perished alone, isolated, perhaps confused, behind closed doors. It's this horrific situation that we Grey Panthers are striving to eradicate by promoting the Essential Caregivers Bill and by offering our platform to outstanding advocates such as Dr. Gullette. Today's distinguished presenter, Margaret Gullette, is a resident scholar at the Women's Studies Research Center at Brandeis University. She's a writer of nonfiction, an essayist, and activist, whose latest op-ed entitled Still Marching After All These Years appeared in the Boston Globe only 3 weeks ago. In addition to American Eldercide, her contributions to the field of cultural studies of age include Age-Wise, Fighting the New Ageism in America, and Ending Ageism, or How Not to Shoot Old People, a book that won multiple awards. Her work in age studies is read in nearly 50 countries, from Australia to Zambia. Today's program will be facilitated by Grey Panthers board member Ron Rowell, who's the host of 45 Forward, a nationwide internet talk show whose mission is to help listeners make the second half of their life even better than the first. So this program is being recorded by our wonderful Emily Trask, and you can listen to it again later on our YouTube channel. So now I'm going to pass the virtual mic to Ron Rowell. Thanks, Ron.
Thank you, Michelle. Delighted to be here. Delighted with my fellow board members to be here, and delighted to have Margaret here. Having been a newspaper editor and reporter for many years.
Ron, speak up.
Yep, I'm speaking up. Okay, listen up. Listen up. We're getting used to the fact that news is like a swift current, and things come and go. And 5 years ago, during the pandemic, seems like 25 years ago, but it shouldn't be, and we're going to make sure it doesn't fade into the distant past. which is one reason your book is so important, Margaret.
Thank you.
Without further ado, what I wanted to do is, first of all, have Margaret speak for about 20 minutes or so, more or less, talk about the book, perhaps read a few excerpts from it, as well as then we will transition to question and answers and then finish up at the end with a few announcements from Michelle. So, Margaret, take us back to that time, what you experienced. Um, your book is in three sections, inside, instead, and ahead. So the first section is about what happened, what you experienced, and the people you talked to. So take it away.
Well, actually, in this heat wave, I happened to be at my summer cabin on a lake in Massachusetts. And it reminds me, and this day reminds me, that my son and his family moved out of Brooklyn, which was an epicenter of the virus. And they stayed here all summer, and we did not. We came to visit a couple of times and we stayed in a hotel and we ate when we ate with them, we ate outdoors at a separate table and the food came out in separate bowls for us and was cleaned separately. And I mean, we had, I suppose we had a relatively easy time of it. They did not get sick. We did not get sick. But this just reminds me of what happened then. What started me writing the book, though, was much earlier. I got back from a conference in March, and I felt that I was pretty much at risk from having been at the conference that weekend. Um, and so I quarantined for 2 weeks, which was what you were supposed to do at that time. And I learned during that period that if you needed um, a ventilator, which was the air of the lung machine that had been used in polio, but was a better kind of machine. If you needed a ventilator, in many hospitals in the United States, a guidance had been put out that said you were excluded on age, by age, and only by age. You couldn't be excluded by race. That was obvious, and you were a special category. You couldn't be excluded by gender. That was obvious. You couldn't allegedly be excluded by disability because there were laws against that too. But there were no laws against excluding people by age. And so I wrote my first article about that. Um,
Go
Was
ahead.
there already a comment? Oh my, yes. If you were 40 years old, you dropped. If you were 60 years old or more, you dropped into a still lower category, and 75 or above, forget it. Um, so I had written a book that Michelle just named the subtitle, and the subtitle was How Not to Shoot Old People. Well, of course, I had been interested in ageism for decades. I'd written book after book against ageism. And that book, which came out in 1917, so long before COVID, um, I wasn't I was not I knew there was lethal ageism. I knew that. Obviously, I wouldn't have been put it in the title or the subtitle. And but the cases that I brought forward were very few, and they were localized. In other words, there were men who were shooting their wives to death in Florida about once every 2 weeks because their wives were very sick and they were incapable. Well, that's a nice way of putting it. They wanted them dead, is I guess the cruder way to put it. Um, in the book, I say, but they were incompetent. They hadn't been trained, and nobody gives people training in how to care for very old, very sick people at home. And in Florida, if there was no, but one man actually went into a hospital and shot his wife dead in her hospital bed where she was being cared for by others. Anyway, um, so that was so lethal ageism came uh, as this unwanted story. And then, and then I got the news about the nursing home deaths. And maybe this is the time to show the cover, Emily. I've got the cover here too.
Yeah, I think we'll try to share the screen.
Yeah.
There we go.
And I had a hand actually in creating this cover. I suggested that there be a grid of faces, and the designer, I'm happy to say, well, actually didn't want to do it, didn't think it would show up well in bookstores, but actually acceded. And then we simply discussed who would appear on it. So I am interested in old people in this book. Mostly they were old people. About 16% of people in nursing homes are not old, however, but for this cover, I wanted mostly old faces, and I wanted 70% of them to be women because, as this part of the book called Inside tells you about what it's like to be inside a nursing home in 2019, most of them were women. 70% of them or so were women. And about the same percentage were indigent, meaning they were on Medicaid, which we now fear we're going to lose. Probably that will come up again later. The others, however, in 2019, when COVID started, the other 30% or so were there sort of, you could almost say by accident. They weren't in long-term care. They were they were there in rehab. Basically, you know, you get up to, I think it's 100 days, 99 days in Medicare for rehab. So a lot of people got, some of them said trapped at that particular point. It didn't matter. So, by 2023, over 1 million Americans had died of COVID. Several groups suffered disproportionately, especially minoritized and otherwise marginal groups. But one particular group gained a historic significance that no one would wish on their enemies. In 2019, which is the US government had provided congregate homes to 1.4 million people who needed care. These people should have been, quote, the object not just of governance, but of good governance, a symbol and indicator of a caring society and of national coherence and inclusiveness. Instead, and for those of you who have the book, I may just mention the page I'm turning to, so you can look it up later. Instead, the United States became divided into two distinct groups and distinct and unequal groups. Those who lived inside the nursing facilities, the 1.4 million, and the rest of us outside. We were then 330 million. People who happened to be living in government facilities were 26 times more likely to die than the rest of us. I'll just say that again, because it's just an astonishing disproportion. They were 26 times likelier to die than those of us in the community. And we know that of all the nations in the world, we had not the very most deaths, but close to the most deaths per capita. So that makes it even more astonishing. And Donald Trump was the president, and he was responsible. These sudden deaths growing every day in the nursing homes posed a fierce challenge to the public health system status quo. It was not only tragic, but scandalous, because it brought to light a new social fact that every resident could have been protected. By sins of omission and furtherance of foreseeable harms, the government enabled an eldercide. Let me just check.
Margaret, can I add to that while you're looking?
Yeah.
So there are also 500 pediatric long-term care facilities in this country. And those children were locked away from their parents the entire time. And I mean, we're talking some places they were as much as 2 years that children didn't see their parents. Independent living for adults wound up falling in long-term care categories, and they were locked in their independent apartments and weren't allowed to leave. So this even went much further than the nursing home and the traditional long-term care. This had a reach that we'll never know how far it really went.
Yes, yes, but I would like to stay with nursing homes for most of this short period that we have together. Because that's what my book is about. And
No,
that's
that's fine.
where I think the reforms that are interesting to other countries as well as to the United States are happening here. So Congress's shaping of the institution had almost guaranteed irresponsibility and lack of coordination. Congress invented a joint state and federal program in which Medicaid, which covers long-term care, is constrained by hybrid public financing, meaning some of the money comes from Congress and some of the money comes from the states. So if there's less money coming from Congress in Medicaid, the burden is going to be put more on the states, and we know that the states have not been very good about that. And in COVID, they weren't good, and some of them have not been good since then. Now, those people should not have died. If they had been protected, they would have lived longer. We know that people who are 70 and 75 and 80 may live a very long time. There were centenarians in nursing homes. Some of them had been living there for decades. And one of them had her 108th birthday there. And she's called a super survivor. She had survived the deadly 1918 Spanish flu. So in May 2020, on the occasion of her second return to health, she was quoted as saying of her family and herself, "They knew that I was a wonder. I met their expectations." She was wearing crimson lipstick, and she was wearing a blue cardigan, and her white hair was beautifully coiffed. She was as vivid as a Jasper Johns flag. So we know that many of them would have lived longer. We know that many of them actually survived. Up to 1 million people in nursing homes got COVID, but probably 80 to 90% of them actually survived getting COVID. So we know that they were healthy and resilient too. Where they survived in 1,950 nursing homes that had no deaths before December of 2020. No, COVID was kept out of those nursing homes. And I'm going to read about one of them. Because at that point, there were 15,477 nursing homes in the United States. So 1,950 did a good job of keeping COVID out. And we know some of the reasons, some of the ways they managed to do it. This was a small nonprofit Baptist-run facility in Baltimore, whose low-income residents were predominantly African American, many with chronic conditions, but not one person became infected. The director, the Reverend Dr. Derek DeWitt Sr., had instantly locked down. "When did you realize the threat was real?" he was asked. It was the day he heard then President Donald Trump confidently proclaim that the United States had 15 cases and it would soon be down to zero. So that was a lie. But Reverend DeWitt, stood solidly athwart the door that Trump left open to viral death. Prevention Oh, he had already hired a full-time prevention infection specialist before this, before COVID. Prevention is what works best in public health. It's a tenet of the field. The readiness was all. Quickly, Reverend DeWitt brought in more personal protective equipment, the robes and gloves and masks known as PPE, and he brought in more TVs because he figured people were going to be bored in their rooms. And he wanted, and they couldn't have joint activities, although there were no doubt in rooms with other people. He hired an extra activities coordinator. He had food brought to residents in their rooms, just what was done in fancy assisted living facilities. He provided food for his employees so they wouldn't leave for lunch and heighten everyone's risk when they came back, or if they came back from another nursing home. His own aunt lived there. As soon as possible, his staff instituted porch visits to counter fear, isolation, boredom, and failure to thrive. And let me just say about confusion, because one of the stereotypes about people in nursing homes is that they're all confused. And that is just a euphemism for their having cognitive impairments, including severe cognitive impairments. But if people were confused in nursing homes, it was because there was plenty to be confused about. I mean, if you saw understaffing, if you saw dirty bedpans, if you saw people with bed sores because they weren't getting turned properly, you were not only confused, you were also angry and outraged. And I just make a parenthesis here. All of this, of course, happened in all the other nursing homes that did not keep their people safe. Um, uh, the parenthesis is about people who had a lot of resilience and they managed to keep themselves going. Um, one of them actually snuck into a friend's room. Um, they staff were resilient. Staff would bring a little birthday cake or a cupcake to somebody's room, and and they'd open the door and people would sing happy birthday. I mean, there were plenty of people who were handling everything that was going wrong as best it could be handled. Now, having talked about how you could be saved, I want to talk about why they weren't. And I'm going to start, well, the President, Congress, the Centers for Medicare and Medicaid, state departments of health, and the administrators and the owners of the nursing homes were responsible in that layered system, starting with the President and Congress. So what happened is that the Centers for Medicare and Medicaid were run by a woman named Seema Verma, and she put out a guidance that was actually a death knell for many people in nursing homes. And this is from chapter 2. It's called Instead, the First Months of 2020. And the subtitle is When Ageism Hardened into Eldercide. There's a cartoon at the beginning of chapter 2, and it shows the protections for the elderly as a wall that is being eaten by a dragon. And the cartoonist has written, "We had one job. What went wrong?" So this is about what went wrong. The Centers for Medicare and Medicaid was the responsible agency. I'm going to call it CMS. In this desperate moment, well, Trump was unwilling to rescue the residents with the most effective means, which would have been sending PPE to them, testing, investing in contact tracing, and funding direct staff at a higher level. Congress did give money to nursing homes, but it wasn't targeted for patient-facing staff. which was a tremendous mistake. So when when Trump declared a national emergency, that gave the agencies leeway to do certain things under their waiver provisions. Social Security enables them to waive various requirements in a national emergency. It was a desperate moment, but CMS had to provide a program for the states and the facilities they monitor that would defer to Trump's inadequate cover story about the facilities. A little bit of a weak spot, he said. Yet it had to look good on paper. So, as chief of some ideologue in the upper echelon of the executive branch had to give abandonment a friendly, authoritative public face. So, as chief of CMS, Seema Verma was that face. She had two audiences whose interests were conflictual. On the one hand, the beneficiaries in the nursing homes and their well-wishers, their families, and the other, the Congress and the nursing facility trade industry. The nursing facility trade industry is extremely powerful, and it spends millions of dollars a year on congressional races, and thus it has influence over Congress. The for-profit lobby had long advocated for less oversight, which translated into lower budgets for them, higher profits for them, and degraded quality of care standards for people in nursing homes. When market forces and good government collide in a crisis, whose expectations matter most? Well, power decides. And what happened is a waiver called 1135. With the 1135 waiver, CMS found a way to deregulate nursing facilities beyond that industry's wildest dreams. And what they did was, the guidance said the states would target the inspectors by sending them only where the need for infection control was greatest. But making this the sole priority permitted officials to ignore other problems like understaffing or the failure to provide PPE. The press release made it look as if the pandemic, not the agency, rendered regular rescue inspections impossible. And the trick rested on Verma's ability to say that protective personal equipment was at a premium. Well, we know it was at a premium. It was widely unavailable. And it stayed so for a crucial 2 to 3 months in the spring of 2020, in which inspectors mostly could not come into the buildings and notice what was going wrong. In fact, Charlene Harrington said, the nursing homes and the states did nothing right in that period. And one of the things they didn't do was to count the dead. Excuse me. They stopped counting in that period. So in fact, we have no idea. I mean, Carrie said this in another context. We have no idea how many people died in the nursing homes because they stopped counting. And some people in the New York Times and the Atlantic did their best to count. So whatever number you ever hear probably needs to add between 16,000 and 40,000 other deaths. And I explain this in various places in the book, but there's an appendix about counting and why counting really matters.
Margaret, will you explain to them what failure to thrive is and how that number was never counted into this, taken into account with this?
Well, I'm sure there'll be people who can describe it better who have worked in nursing homes, but many people, they need a lot of help. If you understaff and they don't get fed properly, or they don't get good food, or they don't get turned, or they're lonely. I mean, and many people were lonely because their families were locked out. And in some cases, they were locked out even when a marital partner was dying. I have a quotation from a man whose wife had Alzheimer's and she was dying, and his state would not let him visit her. He said, I want to hold her fetal body in my arms at the end. So, I mean, there are various ways of describing this. There's a woman who is a MacArthur Fellow who feels that some people just simply didn't get fed. You know, there are people who need to be fed. And before COVID and since, their families, members of their family, come in and feed them. And she believes that there were people who died of dehydration and hunger. But I want to go on to what the 1135. I want to make clear that CMS is responsible at the top level for the lack of inspections. They said that many inspectors will be limited in what they can carry out due to limited supply of personal protective equipment. Well, the facilities owners on Wall Street would have clearly heard, if you have no PPE, you can have no inspections. So what was the incentive for them to buy PPE? It was a terrible public health failure. I think one part of it was that the main mission of the Centers for Medicare and Medicaid is to pay the Medicare bills. But of course, the people who were on Medicare were not being protected either. So they are ranged among those who died in the nursing homes. Perhaps I'll just say another word about understaffing, and then maybe we can turn to the audience, Ron, or you and the audience.
Sure,
Um,
we can do that. Yep. Hmm.
because here I'm going to go back to why CMS is guilty and maybe guilty again for understaffing. Before 2010, Medicare had been rating staffing levels based on the owner's unverified reports, making it easy to game the system. They just would say what their staffing was. Why had CMS trusted those reports for so long? Why had fines been reduced so absurdly that the for-profit chains or equity owners could make business decisions to ignore whatever staffing standard the state had? Why did CMS rarely terminate a license, even of facilities that had injured patients? Why did they never close failing facilities? Before the pandemic, Indiana's nursing home system ranked 48th in the nation for total nursing staff hours when adjusted for patient acuity, despite receiving more nursing home Medicaid funds than nearly any other state. So the state director of AARP asked a question anyone might ponder in their state. When we know there are bad actors within that system, why are we so quick to always protect them? So maybe that's a good place to move on.
Okay, sure. Thank you very much, Margaret. Again, I see there are a couple questions in the chat. If you have questions, please put them in the chat. We will try to answer as many of them as we can. Also, I'm sure that my board members, Michelle and Carrie and others, may have questions themselves. Happy to have them jump in. One of the first questions I think you really sort of covered, but perhaps just to underline it. The question was, what led you to coin the term eldercide, and how does it differ from terms like elder neglect or elder abuse? Well, I think you sort of answered it in one sentence where you say that this was a case where ageism hardened into eldercide. And I think that's, one of your points is that yes, neglect and abuse are terrible things, but these are life and death matters, and I think it's important to emphasize this is what we're talking about. There's no way we can basically soften it into by avoiding that kind of language.
Yeah. Well, I mean, I agree. I'm glad to hear you reinforce that point. elder abuse also went up in those. There's a whole section about that. Um, uh, elder neglect in the community went up. Elder abuse went up. I mean, I think that elder abuse is actually a rather neglected factor. I mean, we think a lot about child abuse, and many of the agencies that are involved in solving abuse are interested in marital abuse and child abuse. Elder abuse is much less covered in the United States. And so I thank that person for that question.
Good. Okay.
But let me say something else,
Sure.
because I actually have a different term than ageism. I felt that when you were talking about the just the ventilator issue in the
Mhm.
hospitals, that was pure ageism. Ageism, pure and simple. It's chronological age, 40, 60, 75 and over. That's chronological ageism. You can't deny it. What I came up with is a term called compound ageism. Now,
Mm.
other age critics have other names for it, but what it means is basically a whole um, a whole intersection of American biases against people who are disabled, first of all, because the belief is everybody in a nursing home is disabled cognitively or with behavioral health issues um, or physically. So ableism is a big part of it. But what I came up with and sexism, of course, is part of it too, because people in nursing homes are known to be women, mostly women, and they are mostly women, but men died too in nursing homes and unnecessarily. Um, but the bottom, I think this is the bottom. The bottom is classism. If we don't turn our minds to the element of classism in uh, in every aspect of health in America, we are just missing a whole story. I mean, Medicaid is a classist system. It's intended, to be for people who don't have means and who don't have insurance and who, um, I mean, Obamacare did something, but Medicaid is a two-tier system. There's Medicare for those of us who've paid into it, and there's Medicaid for indigent people. And the people in nursing homes are mostly indigent. So compound ageism was my attempt to help us wrap our minds around the all the issues combined.
Right. Yeah, we're getting some good questions in the chat now that circle around these issues. One of them that I'm going to just go back to, just to emphasize, I think that there is, this endemic ageism and sort of this attitude that it's some of the things that happen to us as we get older, there's a sense of inevitability, which of course is not true. Um, and so you talk about the issue of medical ageism, but talk a little bit more, and then I'll circle back to some of the questions that zero in on this as well, about just some of just the structural issues of ageism. They're baked into our policies and our organizations. So talk specifically about nursing homes, but I think you've talked about other things as well.
Um, yeah, well, um, it's such a it's such a huge topic.
Yeah,
Um, I think the structural issues that I mentioned, and there's no harm in underlying it. I mean, Congress created this two-tier system in which there would be Medicare for one class of people who were productive during their working lives and were paying into it. Into Social Security, and thus were going to get Medicare at the proper age. And then um, and then the rest who were either of low income during their lives or indigent enough to get into nursing homes. And the last chapter of my book begins with she was, I thought of her as a relative, an auntie, and she had been middle class all her life, but she really needed a nursing home at the end of her life, and she had to spend down all her assets and become indigent in order to get into the nursing home. So, I mean, that's a piece of the way it was set up by Congress in the first place. And it's been very hard to get Congress to make changes in any aspect of it. Um, for example, the minimum staffing standard. Just before Biden left, he instituted with an executive order a staffing standard. It was historic. It was the first time American nursing homes as a whole had to meet a staffing minimum, and he put it at 3.48 hours. Now, Massachusetts is a little higher, 3.58 hours. And Massachusetts is not high enough. Alaska is highest of all.
Countries, so maybe
I beg your pardon? Um, but so I mean, I was able to end my book on a more positive note because Biden had done this wonderful, inadequate but wonderful thing. Well, but Congress should have done it. And they found a judge in Texas in April to say that it was unconstitutional because Congress had not set that mandate. Well, I mean, as long as we have um, illiberal Congress people who are ageist in all the ways that I have mentioned, I don't think we will get a national staffing standard out of Congress. So the Trump's bill that he's trying to get through the Senate now, it's in reconciliation, puts a moratorium of 10 years on any staffing standard. As far as I'm concerned, that was irrelevant, unnecessary. I don't think, unless the next president has, gets a trifecta like Trump did, I don't think we'll get a national staffing standard. And that is what we need. I mean, if you want to talk about the most important structural change that could be made, that and getting private equity out of nursing homes would be the other one. Every time private equity takes over a nursing home, it's in danger. It's in danger of, and the oddest thing, this was a strange discovery. In the spring of 2020 through June, there was a raid by Wall Street on nursing homes. They were buying up nursing homes. And you could say, but that makes no sense at all. Why buy them up when everybody is dying in them? But of course, they were buying up the good ones. And what they do when they buy up a good one, it has goodwill. It has a good patient population. Maybe there's not so much acuity. It has a good staffing standard. They will run it into the ground. And there's been data both before COVID and since COVID that more people die when private equity takes over nursing homes. So,
Ron, we can't hear you.
you
Ron,
can't
we
hear
can't-
me?
I'm just a minute. I'm unmuting. Okay. Okay. So to your point, there was a question in the chat about from Susie Singacardo says, thank you very much for boldly and comprehensively addressing these systemic issues. It's so important for the public to be aware of the truth. We are putting forth much of the same information in our documentary, No Country for Old People, and
Oh,
stand
great.
beside you. Interested to know, given the many obstacles and the intransigence of Congress and of the private equity business, what do you think are some of the ways, some of the quicker routes to reform?
What a wonderful question. And it just so happens that I'm wearing my Dignity Alliance button. Can you see it?
Yes.
Yes.
One of the things that gave me hope as I was writing the book, and of course, an enormous amount of information, is that I came upon a Massachusetts organization called Dignity Alliance. And it is a coalition of the smartest people around improving nursing homes, but also about deinstitutionalizing people. I mean, it has a twofold interest. Um, it's very interested in people with disabilities. We are a state in which a suit was won against um, against the state that will provide home care for about 2,400 people who will be deinstitutionalized, come out of the nursing homes, get into community housing with services and supports. And it's just been one. There are lawyers. There's a bioethicist. There is somebody who ran elder affairs under a previous Democratic administration. It's just the most amazing coalition, and we advocate at the State House. And as long as this administration is in office, I think the action has to happen in the states. I mean, that we can't, um, that's one wing of the action in the states. The other wing of the action is also in the states, and it has to do with the election of 2026. I mean, we have to be really proactive in terms of electing state reps, national representatives, and senators, even if they're not in our state. That, Indivisible has been organizing these demonstrations all over the country. There were 2,000 demonstrations and 5 million people turned up at them. I mean, those are good numbers. They're not as good as they're going to be. The next time they'll be even better. I've been at 3 demonstrations, and that's what I wrote my piece in the Boston Globe about that just came out. They were so heartening, and there were so many old people in those demonstrations. There's one sign that I saw. It said, "I am 93. I have Parkinson's. I am pissed." That was a sign this woman was holding. Another woman said, no, she said, "I am 90." I'm sorry. I am 90. Another woman said, "I am 83, and this is my first protest." So we are bringing out all sorts of people whom Maggie Kuhn would be very proud of. It has just been a pleasure. I see friends who are in their 80s. I myself am 84. Um, I, I know that we have the will, and with the threats to Social Security and Medicaid, where we have the will, we will make the way.
Well said. Um, so one of the questions that came up, or one of the comments in the chat, was just some concern about well, they say Margaret, you gathered firsthand accounts from survivors in nursing homes. What did these voices reveal that was missing from mainstream media coverage at the time? And how should these narratives reshape our understanding of elder care going forward?
Oh, read the first part of the question.
Sure. Well, just
Um,
acknowledging that you gathered firsthand accounts from
Yes, but
survivors.
I didn't, right, but I also, this is somebody who's read the book. My goodness, deep into the book too. I think that's chapter 6 already. That's great. Well, for let me say though, I had an intern, and she and I both looked for stories that were told by residents of nursing homes. It was a Google search. Anybody can do a Google search for that sort of thing. I gave her dates when I thought people would, be journalists would be looking hardest for residents in nursing homes to speak. She read or listened to over 2,000 transcripts. Um, I read several hundred more. Out of that, over 2,000, I think we came up with 20 quotes from residents. Now that is appalling. Those were the people who were closest to, um, they were inside. You couldn't get closer. So that chapter tries to understand what happened. I mean, plenty of people were quoted in articles about nursing homes, and we had thousands and thousands of articles about nursing homes. I mean, hundreds every single day. But the people who got quoted were owners, administrators, nurses, CNAs a couple of times. I quoted a few CNAs. They, not residents. Now, you can say, why? Why? Well, I mean, there were logistical problems, but some people solved them. There are 20 journalists who found these voices, solved them. And when you hear from them, it's not, they're really, they're all over the map. You can't make a graph of what 20 people say and move on from that. What they do is, I mean, one woman was quoted as calling 911 because the nursing home wouldn't call. She felt she was ill with COVID and dying, and they wouldn't call 911 for her. We know a lot about the fact that nursing homes did not call 911 for nursing home patients. And some of them were paid to not send residents to hospitals. We know that. There's new data about that that just came out recently. That it didn't get into my book. It is one of the most shocking things I have heard about malfeasance, real lethal ageism on the part of nursing home owners and managers. Anyway, so the 911 quote and she did get to the hospital and she did die, and very shortly. Um, there's another woman who is calling her son to say goodbye because she feels she's dying. And she's asking him, the first call, she's asking him to get out, to get her out. And the second call, I guess he didn't succeed in doing it. Who knows? Um, the second one, she is saying goodbye, basically. Um, and I believe she also died. These were not the ones that I think at least one of these was called by AARP. So there were other people who were looking for the voices of the residents. But it's a very sad story, actually. I was in touch with the New York Public Library, and they were collecting stories from people who had telephones, um, and I said to them, well, let me know when you know how many are residents of nursing homes. And the woman wrote back to me a year or so later. She said, we've gone through all of these. We have nobody from a nursing home. And she had some explanations for this. I mean, how you collect how you disseminate the information that you
Hmm.
want people from nursing, you don't disseminate it to nursing home to the groups like Dignity that have access to people in nursing homes, for example. Um, but it's one of the sadder stories.
Yeah. Yeah, I think that, having been a newspaper editor and reporter for many years, it's a difficult situation where, and that's why I'm glad that we're doing these kinds of webinars for people, because often these sorts of things don't get covered unless there's a specific incident. There's a case of someone bringing an elder abuse, case against, a nursing home or something specific. But these things are happening all the time. And then they're once that they cover the story and then they're dropped. But I think it's important to keep these issues alive and present, even when there's not an incident to provoke discussion about it. So,
Absolutely.
Michelle, how are we doing? Do you want to? I know that we usually reserve a few minutes at the end for you
We have
for
5.
announcements and things.
Yeah, we're okay. There's some really good questions. How about, well, Emily has this question. The book ends with a call for pro-aging cultural and policy change. What's one thing we can do to advocate for dignity and protection for those in nursing homes? What can we do now in our own communities? Any advice?
Well, great question. And yes, I think so. Um, I think we can use the media much more than we do. Um, uh, I I try to publish. Well, I just published in the Globe, and I just published a long essay someplace else in a literary cultural quarterly. Anybody can write a letter to your paper. And if your paper is not a major paper, all the better. Okay? You know, raise the issue in your community. And the issues are just falling on our heads like lead weights. I mean, the attack on Medicare, the potential attack on Social Security, the fact that I saw another wonderful sign. It said, if a parade, why not Medicaid? Okay, you can make a letter out of that. You know, these letters, they're very short. You don't have to be a great writer to write a letter to the editor. It does help if it's pithy. You know, I mean, I read the letters to the Globe all the time, and it's the way the community talks to itself. And I mean, I think there's another thing to do, and I am encouraging it in Massachusetts. For any group, you could do it in your state. I don't know what's coming up in front of your legislature. I always know what's coming up in Massachusetts because I belong to Dignity Alliance Massachusetts, and they're having a meeting that I'm missing right now, and I take my marching orders from them. So the last time I was on with them, they said, send a letter to your state rep and your state senator and write to them about the personal needs allowance. Okay. If I, you know, if I were looking at the whole group, I would ask, how many people know what the personal needs allowance is? Probably a few, but okay. I see one hand, but I can't see the whole grid. The personal needs allowance is when you go into a nursing home, you actually pay your way. You pay in with your Social Security check, and you are allowed to keep a certain amount of it out for your own personal expenses. And it's called, in its childlike fashion, an allowance, just as if you were 8 years old.
Mm.
And with that allowance, which in Massachusetts is $76.20, if I remember correctly, you must pay for everything. So if you have a cell phone, that probably takes up most of it already. If you want to offer your family a pizza, that must take up most of it. So we want to raise the personal needs allowance in Massachusetts. And there's a great argument for it. It hasn't been raised in 16 years. It hasn't been raised with inflation. We only want it to go up to $113, and it would only cost 11 million, which is bupkis, as we say in Brooklyn, which is bupkis in the $1 billion budget of Massachusetts legislature. So I wrote to my state senator and my state rep. I'm trying to, my state rep is a newbie, so I am trying to educate some of the newbies about these important issues. And when I talked to the Massachusetts social workers a week or so ago, I said to all of them the same thing. Write to your state rep, write to your state senator about the personal needs allowance. You know, these social workers come from all over the state. We could really have covered, be a sponsor, be a co-sponsor. Please, give them dignity. Give them
And
dignity.
understand, it's different in every state.
Yep, it
Okay,
is.
personals leave, well, in Illinois, it's still $30.
It's appalling. I
Yes,
mean,
absolutely
they're
appalling.
right. And I don't know what it is in New York State, but and maybe it's not the issue that I mean, I think Great Panthers could, decide what issue it's going to promote and then, you know, spend whatever, pick an issue a month, pick an issue every 2 months that is in front of the legislature at this time, and just get. I mean, you have membership, you have the means, they have the means. It's a highly educated group. It's an honor to speak to people who actually read my book and come to these kinds of talks. Um, so yeah, I think you have a large potential there. And maybe you're already doing it. If so, I apologize. But there's going to be the legislature in New York is a very complex, instrument like the legislature in Massachusetts. And there is a lot of corporate power over state legislators, because the lobbies are so powerful. So you are, you're opposed to the lobbies. You
And
are a lobby that is opposed to those lobbies.
today
And
is
more power
primary
to you.
day. It's primary day, so thank you for reminding us about the scary choices we have. I also want to acknowledge that we have Susie Singer Carter here. And
Oh,
I don't know, Susie, do you want to say anything about your documentary, No Country for Old People? I see that you're launching a movement.
Yes, I am. Thank you. Thank you, Michelle. I appreciate that. Hi, Margaret. Thank you. It's nice to see you.
it's
And
nice to see you again, Susie. You interviewed me for your movie.
did. And yeah, we're happy. Rick is on as well. We're happy to announce that we are going to finally be streaming August 1st on Amazon. And that's such a big, it's literally, this has been such a hard road because it is the topic that no one wants to hear about. And so as you know, Margaret, like getting the public, outside of our silos to actually know what we know. And that's the most important thing, to get the collective on board with us and to really understand, so no one gets sucker punched like most of us have on this call, right? So I'm very, very proud of you and proud of all of our team for this documentary, because we need more and more information out there. So thank you. And
Well, thank you.
and also, yeah, we are launching a movement, Roar. And we are asking for people to join us and become a Roarier, which stands for respect and oversight, advocacy, and reform for quality long-term care. And we are applied for our 501c3. We're not messing around. We're starting our board. We really want to engage with the public and get out there and educate and make sure that just stop this already, just stop it. It just needs to stop. So put that out there. If anybody wants to know more about it, you can go to No Country for Old People and .com, and there's a tab about the Roar movement, and would appreciate as much, participation as possible, because it's going to take a billion villages, but we need to do it.
Right.
Thank you.
Yes, well, thank you. I'm so glad. I hope that it does very well and is seen by, millions.
Thank you. And me too. Me too. The labor of love, for sure. Thank you, Michelle, and everybody, for letting us talk about this. I appreciate it.
That's great. Yeah. So I'm going to hand it back to you, Michelle, for final words and
Sure.
closing thoughts.
So, well, good luck everybody in voting today. We are a 501c3. We cannot support anybody, but just, I guess, keep an open mind, and I don't know, good luck to everyone in New York. We're going to meet again next month on July 29th. We're going to have Lori Porter. I think most of you know her. And Janine Ferrari, who's a new volunteer with us and is a family council advocate. So we're going to talk about caregiving and how to bridge CNAs and family caregivers. Thank you so much, Margaret. This has been amazing. I don't know if you want people to know about the discount if they want to buy your book.
Oh, yes. Oh, sure. Yeah.
Okay,
if
so
you-
I can put it in the chat.
Why don't you
So
just say it right
yeah,
now?
I'll say it. So you said for 30% off, the code is UCPNEW on the University of Chicago website.
Yeah.
So we'll include that. Well, not to everybody, but yes, so those of you on the call can get 1/3 off. So you heard that discount, it's UCPNEW. You have to go to the press.uchicago.edu website. So thank you very much, especially on this boiling hot day.
Well,
Having a deep conversation, and we apologize for the intrusion, but oh well, we got through that. So,
Oh, I had
yeah,
forgotten that. But
yeah.
thank you, Michelle. Thank you, Ron, and thanks to everybody who put those wonderful questions, those wonderful, well-informed questions in the chat. It is a great honor to talk to this group that is carrying on these anti-ageist ideals and wants to do it better.
We're doing what we can under all these circumstances. So thank you, and see everybody next month, July 29th.
Great.
Stay
Thank you, Michelle.
hydrated. Bye.
Bye.